We still hear public health experts saying that, we can't have an over shortage of essential workers in our hospitals as hospitalizations go up. What is your response to that?
If we had been cared for properly from the get-go, you wouldn't have the shortage that you are now, even with the surges. We have weathered the surges. And I think I did hear what Dr. Fauci said now and before I watched it, and I will be willing to give them that the decision was not made solely because a corporate head asked for it. But those things do matter. They do matter. And those of us who work in that environment, I believe, are not being listened to as much as those other voices who want to keep profits going, who want to keep everything open and things running smoothly. If we do what we nurses know you need to do, which is operate on the precautionary principle, take care of your workers, in other words, make that emergency OSHA standard permanent for us and other frontline workers, give us the proper PPE, have people continue to hand wash and distance and wear your masks. With or without the vaccine, we would be in much better shape.
Let's talk about the OSHA emergency mandate that you just mentioned running out at 6 months. It included things like you just said, testing, PPE, general things to make sure that hospital staff are kept as safe as possible with the spread of COVID. Have you heard of hospitals dialing back those protections once that OSHA mandate ran out?
Well, they dialed back protections from the beginning before the standard. And then when we had the standard, they complied for a while. But our experience with employers is they will dial it back. Absolutely, they will. The push to get us back early and not have us stay out as long when we exhibit symptoms or we've been exposed has always been there from the employer. That's not going to change. They do things because they're forced to do them, not because it's the right thing to do.
Got it. Okay, so at the same time, there's this argument, though, that we need nurses to help with this surge in hospitalizations. What is your response to that?
Nurses have always been at the core of any kind of disaster. This is no different. We will be there, we will stay there, we will come back over and over again as long as we are properly protected. You saw what happened in the beginning, convincing them that we needed the right PPE. Even now, I believe the CDC could do us a big favor and fully come out with a statement that, yes, indeed, one of the reasons this is surging so rapidly is because it's airborne. And therefore, this is the type of mask people need. And then when you're in the hospital working as a nurse or other healthcare worker, you need the proper respirator type covering if you don't have enough N95s, the proper, what we call positive air pressure, respiratory, purifying respirators. We call them PAPRs and CAPRs that you wear as a hood over your head. Those are the kinds of things that will keep your workers safe, keep them in the hospital and keep them coming back. And having enough staff so that you can don and doff properly. The employers never did a good job of that before the pandemic. They really need to do it now.
And you mentioned earlier this idea of burnout that, of course, has impacted pretty much everyone over the course of this pandemic, but of course, especially our healthcare workers. What do you think is the biggest thing that could be done to address the burnout that we're seeing for nurses across the U.S.?
I know lay people call it burnout. We don't. We don't feel like we're burned out at all. We are very distressed. We are morally distressed. It's really hard to come to work every day and have nurses do their job, but not be allowed to do it because you don't have the right staff or the right mix of staff. You don't have the proper PPE, et cetera, that I mentioned. So it's morally distressing, and we keep fighting to make it better. That's what's going to get nurses into the field and keep them there, even during a pandemic. You saw people willing to sacrifice and transfer from other areas, other states to your state in order to help. Nurses do that, and they will, but they can't continue to work under circumstances where their care isn't valued and there aren't enough of them to support each other to do their work.
Jean, before we let you go, I want to get a sense from you of what you're hearing from your fellow nurses about just the situation with Omicron. Obviously, a huge surge, but we're not yet at the peak of hospitalizations that we saw with Delta. What are you hearing from people who are in the ground in these hospitals about how bad things are? And what does that indicate to you about where we might go heading into 2022 with our fight against Omicron?
Well, they know that the flu season will come and go. It always does. And if anything, people are wiser about wearing masks for the flu. We would feel much better if we had a higher rate of vaccination. And if people if they didn't rely so much on that vaccine, but use the multiple approach I talked about. It's best to quarantine and for the right amount of time. It's best to get testing and have those tests recorded so we get a better handle on where things really are at. All of our numbers we know are undercounted, all of them, including the deaths of healthcare workers and nurses. So that's the kind of thing we need, this multidisciplinary approach, this approach of many, many ways of keeping separate, of keeping clean, of keeping non-infected, in addition to that virus. So nurses are nervous, but so far they're handling it. They're very worried that it will get as bad as it was in the beginning.
Yeah, it's shocking, I guess, is not the best adjective, but it's surprising to me that we haven't figured out a way to track these breakthrough cases versus the hospitalization status for the unvaccinated. What do you think is a change that could be made in hospitals to track that data better?
Well, if they had to do what the ETS said, which is make sure that they do record them and report them, make sure that we as healthcare workers get tested when we've been exposed, make sure that patients are cohorted properly. If they may be COVID, they'll go to one area. If they for sure are COVID, they go to another. If they're proved to not be COVID, they go to another area. And you don't have the nurses have an assignment where you mix among them. And then I'm not sure it's true that we can't do the testing. One thing that's holding us back, of course, is we don't have a really good public healthcare system. We don't have a public healthcare system. Everything is private. Everything is, well, for lack of a better term, you can't make me. That's why we have CDC guidelines and not mandates. So if people all banded together and did what other countries who do have a national health system do, we could go door to door even, and we could make sure that people were not infected and staying not infected and have a better handle on things.
Jean, really appreciate your time. Thank you so much. That was Jean Ross, president of the National Nurses United organization.